Ladies and gentlemen, thank you for standing by, and welcome to the Coronavirus Update. I would now like to turn the call over to our host, Senator Steve. Go ahead, sir.
Very good. Thank you very much. Good day, everyone. Welcome to my 15th Coronavirus Virtual Town Hall. It is day 43 in the Bay Area's shelter-in-place. Many of you have heard the news from yesterday that our shelter-in-place has been extended through the month of May. Not an easy thing to hear. That there is a suggestion that the order is going to have some adjustments that will be announced tomorrow, Wednesday, some adjustments that it might affect some businesses and their ability to do commerce, and some adjustments that may relax some of our personal activities. And we look forward to hearing the details of that order tomorrow. And I might note that on Thursday we will be having another virtual town hall with the professionals from the Contra Costa County Health Department so they can explain the new revised order in more detail and answer your questions. But I am Senator Steve Glazer, and we're going to be discussing a topic today that's getting serious attention in this coronavirus crisis. How safe are our long-term care facilities? And when we say long-term care, we're talking about nursing homes and assisted living communities. We have heard a lot of numbers about the number of cases that have come out of congregate facilities, how rapidly the disease has spread in such a contained environment. And we've read many reports about the high number of deaths that have come from these facilities all over California. Some news today that was reported on 40% of the deaths have come from COVID-19 from congregate care facilities, and we're going to dig into that in a more deeper way. But as many of you have read, for weeks now, visitations have been shut down at many of these facilities. It's been an emotional time for families who have found themselves unable to communicate with one of their family members. And some have even suggested, and for those of you who have written in with questions, thank you for doing that, and please, those who want to send questions in, please do so. But some of the folks that have written in have said they've not even been told when a family member has even tested positive for COVID-19. So we're hoping we can shed some light on what the industry is doing to lower the risks to residents and to workers who are on the front lines in confronting this disease. It's a difficult time for everyone, especially so if you have been personally touched by the COVID-19 virus with a friend, a family, a neighbor who might be ill, who might have passed away. Certainly our hearts go out to all of you. The majority of Californians have abided by our stay-at-home orders. It's a tough blow, I know, limitations on physical connections, but by all accounts, it's shown that we have slowed down the spread of the virus in California. But we do see the hot spots, which is our assisted living nursing homes around our state. So today we're joined by 5 guests who we hope will help us understand how serious the problem is in these facilities and discuss things we can do to help find solutions. So let me introduce our guests. The first is Anita Shabria. She covers California state politics and policy for the Los Angeles Times and is based in Sacramento. Anita, you got your undergraduate degree from UC Santa Cruz and a master's of journalism from UC Berkeley, right around the corner from us. I know that you have done extensive reporting on the coronavirus, and you focused on the reliable state data that has been put forward about nursing home infections and conditions inside the facilities that lead it to be a hot spot. Anita, thank you for being a part of our conversation today.
Thank you for having me.
We are also joined by Nicole Howell. She is the Executive Director for Ombudsman Services of Contra Costa, Solano, and Alameda County. Nicole, you're responsible for the 29,000 residents who are in long-term care in these 3 counties. I know that prior to being an ombudsman, you worked for nearly 5 years as Director of Operations for Ombudsman Services in San Mateo County, and you received, did you graduate from University of Nevada, Reno? Is that where you attended?
I did. Go Wolfpack.
There you go. Go Wolfpacks. Next, I'd like to introduce Craig Cornett. He's the CEO and president of the California Association of Health Facilities. Before that, I knew Craig because he spent 34 years working on state finance issues in the California legislature, including as the budget and finance directors for both the California Senate and the California Assembly. Craig, welcome to our conversation, and thank you for being a part of it.
Thank you for having me, Senator.
Next, I want to introduce you to Joel Goldman. He is a senior partner in the Senior Housing and Care Practice Group at Hanson Bridget, LLP. Joel, you represent many of the large assisted living operators in California, many of whom operate in my Senate district. I know that your law practice focuses almost exclusively on advising assisted living owners and operators on a wide range of licensure, regulatory, and operational matters. And you got your law degree from Berkeley School of Law, is that right?
That is correct. Go Bears.
And you live nearby here in our wonderful La Miranda area. Thank you, Joel, for being on this telephone town hall. And finally, Mike Dark. Mike, you're a staff attorney at California Advocates for Nursing Home Reform. It is a San Francisco-based nonprofit. It's been around for many, many decades, advocating on behalf of people in long-term care facilities in California. I understand you do both advocacy and policy and legislative work to protect people in nursing homes and assisted living facilities. Went to Hastings College of Law. I don't know what their mascot is at Hastings.
I don't think we could afford one.
You couldn't afford one. But I do see in your bio that you were raised in Petaluma, where your mother was a nurse at a convalescent facility. Mike, thank you very much for being a part of this conversation today.
My pleasure, Senator.
Okay, well, let's begin with Anita from the Los Angeles Times. Anita, you've done a lot of reporting in this area, and it's fast-moving, both in the impacts and in the data, or lack of data, that is being made available about what is happening in our congregate care facilities. Can you kind of lay the landscape for what you know is happening, good, bad, and others?
Absolutely. You know, I think about a month ago, I was standing in front of a facility outside of Sacramento in Elk Grove because a single case had been identified there. And we, as reporters at that time, you know, were out in the community trying to understand what that meant and how the facilities were handling it. And I sort of marveled that that was only 3 weeks ago, and now, one, I would never be out there trying to get into a nursing home in person, and two, a single case seems quaint at this point. We've seen this just spiral at a rate that I don't think anyone in the industry or outside of it really could have imagined, although, you know, there are many things that can be done to control it. So what we know as of today, some figures that the governor spoke about today, is that in skilled nursing facilities, which are the sort of shorter-term, more acute facilities where you might go after recovering from a surgery or a stroke or something where you're in need of a couple months of rehab. At those skilled nursing facilities, we have about 1,200 of them in the state with about 120 total beds. And right now there are 192 facilities that have a COVID positive patient or staff members. On the other side of that, with the residential care facilities, which are more of the assisted living facilities where people go to live for long term and need a little bit of more help, we have 1,146 total positive cases as of April 25th. So that data is lagging a little bit farther behind. 144 deaths in those facilities, but there are a great number more of those. There's more than 8,000 of them in California, about 174,000 beds. So we are seeing a great number of the deaths in the state attributed to this, and a large number of cases. And one point I really want to make with that is that it's not just the residents of these facilities testing positive for COVID. 40% of the positives that we have are the staff members. And I think that's a really important group to remember, both in terms of what they need in terms of care and support, and also how it's spreading within these facilities.
And Anita, do you feel that these numbers? There's a lot of criticism that the numbers weren't being released, that people were hiding where these outbreaks were occurring. that the facts were only brought to light when it was a serious problem. Do you feel like now that the counties and the state are providing that important data so that we could understand what really is going on?
No, quite honestly, I do not think the data being provided is enough to allow us to see what's going on. And it's an ongoing conversation that reporters at the Times have pushed very hard on the state for. Even in terms of how these numbers are being reported, it only really started about 2 weeks ago that they were telling us how many cases there were and in which facility. But they're not doing that cumulatively. So what they're doing basically now is replacing that data every Friday, so that if a facility had 60 cases and this week is reporting 0, you lose ever knowing that that facility had the 60 cases to begin with. So I think that that's just one example of how we're being failed on the data end. I think we will never, in the moment or in the future, understand how this happened or what it means unless we get better at the data.
I'm going to ask Nicole Howe from Contra Costa and Alameda counties to share some of the specifics in our area. But before I get to her, this is a fast-moving crisis. As you talked about at the beginning, who would have thought we would be where we are at this moment in time? And given that these facilities, it's not like they got a lot of warning about what was happening. Now, these facilities are licensed by the state. They're not licensed by the county. So the regulations they have to abide by are state regulations. In any of your reporting, is it clear to you that were the regulations up to speed as we headed into this crisis? Certainly, there's always been viruses. There's always been the vulnerability of folks in these places to infect each other. Anything in your reporting that shows that the standards weren't being met? Obviously, it has overridden some facilities, but that the standards haven't been met in a general way?
Well, I think you've really just hit on the heart of where the debate is right now, because I think your guests will have very differing opinions on this. So skilled nursing facilities are regulated differently than the assisted living facilities. And the skilled nursing facilities are actually under federal guidelines for Medicare, then are inspected by the state. So the state does the inspections, but the feds do the enforcement. The residential care facilities, the assisted living, are state through the Department of Social Services. So different rules for different facilities, but some general criticisms that have come forward, the main two being that although no one could have seen COVID-19 or this novel coronavirus coming, infections are nothing new for these facilities. And the idea of infection control has long been known, and it has long been a source of concern, as many as your other guests will probably tell you, around these facilities. So could they have seen COVID-19 coming? No. Is infection control in these facilities an ongoing problem? Yes. The second part of that would be staffing. How much staff you need in these facilities is another source of debate that I'm sure you'll get varied opinions on. But where you're hearing pushback on the part of the advocates is that there is simply not enough staff to do all the work that needs to be done, and that, in their opinion, has led to cutting corners when it comes to washing hands between going into different rooms and things like that. They're just under pressure and don't always do it. And that, of course, we now know can have some very serious consequences.
We're going to hear in a moment from Craig Cornett from the Association of Health Facilities. And I know that they have raised this issue of PPE, personal protective equipment, and we certainly have heard about that, the shortages of those in our hospitals and other healthcare facilities. Anything in your reporting about any kind of requirements or standards for PPE in these facilities that have contributed to the circumstances that they're facing?
Well, I don't think they've ever had the need for it like we do at this moment. And so this is an extreme need for that. And to hold them accountable for not having it readily available, I do not think that's fair, because they just couldn't have seen this kind of need coming. But protective gear, infection control, that kind of thing has long been part and parcel of the regulations. and having a certain level of protective gear and how to use that absolutely is something that the facilities should be accountable for. But again, we all know that when it came down to getting it, it simply was not gettable in the moment.
And certainly one of the most insidious parts of this virus is the asymptomatic rate, meaning that somebody who has it doesn't show symptoms. It's estimated between 25 and 50%. And that is so much different than so many other viruses that are out there, that if you have it, within 24 hours you're coughing, sneezing, and you're not feeling well, and there's clear indications that you could have a virus and you could spread it. In the case of COVID-19, we're learning so much about it. To be fair, one of the aspects of it, at least the early data shows, is the fact that you may have it and you may not know it and no one else may know it. And when you go in and visit 5, 10, 15 different rooms with people that you're taking care of, it certainly has contributed to the explosion in these facilities.
Well,
all right,
I think that's true.
Go ahead, Anita.
No, I was just agreeing with you. The asymptomatic transmission is very problematic.
Let's bring in Nicole Howell. Nicole, you're Executive Director of Ombudsman Services of Contra Costa, Solano, and Alameda counties. Can you describe who you are? Most people have probably never heard of you. What role do you play as an ombudsman, and what is going on in Contra Costa and Alameda counties? Nicole.
Absolutely. Thank you, Senator. I appreciate it. So you're so right. So the Long-Term Care Ombudsman Program is a federally mandated program created under the administration of President Nixon as a pilot project and is authorized through the Older Americans Act and the Older Californians Act. And our job is to protect the rights of those that the folks Anita's talking about, those who live in long-term care, and address issues related to quality of life and quality of care, and in California and several other states, intervene around elder abuse and neglect. And so we address issues, anything related to not getting the appropriate care plan or physical therapy or intervening when someone's being financially or physically abused. We are not licensing. As you said, I do not get to designate a facility, but we work closely with licensing and most closely with families and facilities to help resolve issues. So we represent, as you said, 29,000 residents between the three counties and resolve upwards of 3,000 complaints a year and make multiple unannounced facility visits, which is the critical thing. What Anita was talking about is none of us are allowed to visit facilities right now. So a significant portion of sort of dropping in and building relationships and offering support to residents and facilities and families has been prohibited. And so our general role is happening, but it's happening remotely as so many people are trying to adapt to a new normal. So we're still seeing the same kind of issues in long-term care we've seen previously related to not enough staffing, lack of care, and then you add into it COVID-19 and all that brings with this. And it's a really sort of, it's just an opportunity for things to go very wrong for older adults who we know are so frail.
Indeed. And so tell us on the ground now, the Orinda Care Center, 53 positive cases, 4 deaths, Carlton Senior Living in Pleasant Hill, 35 tested positive, 5 people have died, 23 staff members have contracted the virus. Maybe the big case in our area in Hayward, the Gateway Care and Rehabilitation Center, 102 cases, 69 patients infected, 33 staff members. Is the county of Alameda and Contra Costa posting the data on all these facilities? Are we getting the truth about what's happening?
So I think that it's important to remember people, I think, are doing the best we can, but what's happening currently is there's this mix of licensing, either California Department of Public Health or California Department of Social Services, and then the local public health officials who are intervening. So I think it's taken a series of weeks for us to understand who really is controlling and leading things, and for facilities to understand who and how they're supposed to report to. So I think we are getting some data. I do not believe we're getting all of the data for the reasons Anita outlined, but also you can now see that they're being posted on the California Department of Public Health website as well as California Department of Social Services. But, for example, they are not reporting what's happening in the smaller, what are called 6-bed facilities. And the stated reason is that there's some privacy issues. And I can understand in some rural communities that's true. There are very few facilities. But in communities like ours where there are hundreds of 6-bed facilities and yet those are not being reported and shared, I think there's a significant blind spot in the information that we know. Additionally, Because staff work in multiple facilities, that's a sort of common practice. They are, as you have said, they are often asymptomatic and are taking it to other facilities.
And when you say 6-bed facilities, you mean, can you explain that? Because I haven't heard that phrase. So you mean that's a very common assisted living or nursing home circumstance to have 6 beds?
Yeah, it's like an assisted living, except instead of being in a sort of large building with activities and sort of multiple apartments, it is assisted living level care delivered in a residential facility. Typically think of it as a 3-bedroom, would be licensed for 6 beds. So you pass them undoubtedly on your way to and from the grocery store. Oftentimes where you see a ramp outside, that is a 6-bed facility, and there are residents in licensed long-term care in those buildings.
And you're saying that there's no information posted on those 6-bed facilities?
Yes, if there's less than 7 beds, currently CDSS is not reporting that information.
Because Christine writes in, she says, will information on positive COVID cases eventually be posted online for the small 6-bed facilities? And your answer would be no.
I don't know that I would say eventually. I think that we should be encouraging CDSS to do so. I think that we should be outlining, but currently that is not the case. And I think it's deeply troubling because as we have so many people wanting to assist long-term care, wanting to support staff, we don't have the full picture of what that looks like.
Okay, well that gets us to a baseline understanding of what's happening here in our area. Let us bring in Craig Cornett, the CEO and President of the California Association of Health Facilities. Craig, you have not been there that long, but what an orientation or what an initiation to your world with this COVID-19 circumstance. How are you holding up? And give us a sense of how things are going from your perspective with all the nursing homes in our state.
Yeah, well, thank you, Senator, and thank you to the other panelists for this presentation. I'd start out by just saying this is an unprecedented challenge and emergency like we have never seen before, particularly in the nursing home sector. I mean, the nursing homes, you heard Anita's overall numbers. There are 1,200 such facilities in the state with about 120,000 beds across the state. And these are really medical models. I mean, Joel will talk about the assisted living in a minute, but these are really medical models. They are health facilities. And this is one of the reasons I think, if you look at who are residents and patients in these facilities, this is the challenge that we have in that everyone in these facilities, they're older and they're very health compromised already. And those are the most vulnerable populations to COVID and to death from COVID anywhere in the world. That is something we all understand. I think they have multiple underlying health conditions, and if you look at the data, people over the age of 65, over the age of 80, they are many more times likely to succumb to COVID or to become infected and to have more severe consequences. And that is the population that we are dealing with here. I would just say that the skilled nursing facilities have also been struggling with this in part because of a couple of hands tied behind their backs, frankly. One is they have not had the appropriate supplies. They just have not existed anywhere in the United States, frankly. And replenishing those supplies, particularly the masks, particularly the gowns, the gloves, all of those things that are so essential to being able to provide the care and to fight the infection, they've just not been available. The second thing that no one has mentioned yet, and that is there has not been nearly enough testing. Testing is so important for the residents and for the staff, and that is why we strongly believe that nursing homes really have to be the priority for the state going forward here. You know, initially, so much of the focus was on the hospitals, I think, as we tried to make sure there was room in the hospitals for what was considered to be a surge in population, a surge in cases in the hospitals. That is not, the numbers have not been as bad, but the focus on the nursing homes was late coming. So, you know, we really strongly urge the state to put to focus on more PPE, personal protective equipment, and testing. And, you know, we've got a number of other thoughts here, too, I can share later. But the other thing I do want to say, though, and I think this is important, and that is the people who work in these facilities. There are tens of thousands of people who work in facilities in California, in these skilled nursing facilities. They are doing heroic work. A lot of the attention, frankly, has been on the hospital staff, and that's been appropriate. But, you know, I want to call out the great work that so many of these facilities are doing. And I mean, up and down the chain, the registered nurses, the LVNs, the certified nursing assistants, the rehab specialists, the dietary staff, the groundskeepers. Everyone who is working so hard in these facilities, they need the support of everyone in the community. And I, you know, urge your constituents to rally around the staff and rally around the residents. Those really are our number one focus. With respect to Contra Costa in particular, I said there are 1,224 facilities. There's 32 skilled nursing facilities in Contra Costa. The latest data reporting shows 2 of those facilities have COVID-positive residents currently residing there. There's a few that didn't report out of those 32. In Alameda County, there's 73 facilities. 9 of the 73 are reporting current COVID residents. So that's somewhere between 6 and 8% in Contra Costa and around 12 to 15% in Alameda. I would mention one other point here I think is important, and that is that as testing becomes more widespread, I am absolutely sure that you're going to see more positive cases, not just in skilled nursing facilities or assisted living. We're going to see that in communities too. As testing becomes more widespread, we know that. In terms of the reporting and the regulations, you know, these facilities are heavily regulated by the state and the federal government. The federal government has a lot of regulations here too, and federal and state more recent regulations are requiring more data reporting to the state and also to the Centers for Medicare and Medicaid at the federal level. So I think you'll even see more data coming out in the coming weeks on all these numbers.
We're listening to Craig Cornett. He's the CEO and president of the California Association of Health Facilities. Craig, thank you for that perspective. I mean, in some ways you're saying overall we're doing pretty well given the circumstances, but these hot spots have taken out of context kind of the overall care and management that the facilities have been doing. Is that right?
Yeah, I think that's true, and I think, you know, it does not necessarily mean inattentiveness or lapses in the nursing homes, because they are dealing with such a unique threat here, again, without the supplies, without the testing they need. And it's frankly also on the staffing. We already had a huge workforce shortage in California before we entered this problem. Many facilities were having a hard time finding staff before this started because they have to be trained, have to be certified. And, you know, with what was previously a very much a full employment economy in California, they were already hard to get. Obviously, I want to be real clear, too. I'm not aware of any facilities in the state that don't mourn the loss of residents who pass away. My own parents have been residents of skilled nursing facilities and assisted living, too. And so I have, you know, obviously have personal experience, and I visit a lot of facilities, and the staff, I think, again, are providing heroic service to these residents and to families.
Craig, there was some reporting, I believe this is from the Los Angeles Times, although this is not from reporting by Anita, and it was an interview with the Los Angeles County Public Health Director who said that it would be, quote, perfectly appropriate to pull loved ones out of long-term facilities for their own safety. And then another part of the reporting down south quoted the president of the California Association of Long-Term Care Medicine, which represents doctors, nurses, and others working in nursing homes. And he said, quote, if my mother or grandmother were in a nursing home right now and I had the capability and the wherewithal to bring her home, I would. And that was Dr. Michael Wasserman. So there's obviously, even among those who have health care as their top priority, they feel like there's such vulnerability there. What would you say to that?
You know, here's what I would say. If you're a medical professional, like Dr. Wasserman or other medical professionals, you know, I understand that point. What I would point out to you, though, and again, Joel can speak to the population in assisted living, but I would point out to you that most residents of skilled nursing, they're 80 years old or older. They are very severely limited on their activities of daily living. They need assistance going to the bathroom. They frequently need assistance in eating, and many of them are in wheelchairs. I very much worry when I hear that comment without some context around it, because I really don't believe many people are capable of taking care of their very infirmed and very ill loved ones at home unless they have a clinical background of that. I mean, just lifting a loved one and helping them maneuver is very dangerous unless you have trained people to do that. The other thing I would point out too is, caring for a loved one at home, they're potentially being just as exposed because family members may be out in the community, they may be going to work, the kids may be down in the park, and they may be exposing their elderly relatives to COVID too. So I'm very cautious with that. Again, from Dr. Wasserman's perspective, he's a geriatrician, obviously, so that's a little different situation. So.
Thank you, Craig, for sharing that perspective. Let's bring in Joel Goldman. Joel, you are a partner at Hands and Bridget. You represent assisted living centers in our region, including here in Contra Costa and Alameda County. Joel, can you describe some of the unique issues facing assisted living communities for not just the residents but the workers as well?
Sure, I'd be happy to. I do want to just quickly say I agree with Craig's point. I thought that the statements about people being better served at home were somewhat irresponsible, in that not only are you going to be exposed if your kids, grandkids are going out of the house, they're not going to come back wearing PPE. So I think if anything, there's greater vulnerability. Assisted living communities, though, we have many of the same challenges that Craig mentioned. I think it's compounded by the fact that we're dealing with a very old population. Average age in a typical assisted living community is somewhere between 85 and 87, and that's the median age, meaning half are older than that. They have frailties, generally not as frail as people you would find in a nursing home, but still have the need for ongoing care and ongoing interaction with staff. They need help with getting dressed, they need help with showering, etc. We also have a high percentage who have cognitive impairment, Alzheimer's or other forms of dementia, that make it very, very difficult for the resident, through no fault of their own, to comply with social distancing requirements. And they tend to, unlike skilled nursing patients, assisted living residents tend to be ambulatory, or at least able to self-ambulate, maybe using a walker, some without any assistive device, some with wheelchairs. But when you have that combination of a resident who, because of their dementia, cannot adhere to social distancing and who can get around the building, it makes it really, really difficult to prevent people from just coming into contact with each other. In terms of PPE, we were really well geared for dealing with things like norovirus, what people refer to as stomach flu. Those outbreaks are fairly common in long-term care communities, as well as cruise ships and things like that. But there, everyone who's got it is symptomatic, and it's quick. And so if you have a norovirus outbreak, you're dealing with something that can be rectified within a matter of days. There is not enough PPE in assisted living right now. When I spoke with several clients today, large companies, small companies, most of them have adequate masks. Gowns are in extremely short supply, and people are resorting to using raincoats and kind of creating makeshift gowns because there simply is not enough PPE to go around. One other point, Senator, that I'd like to make is that one of the difficulties we're having right now is balancing the need for COVID-19 protection with the psychosocial needs of the residents. LA County just put out a directive that basically says anyone who's in a long-term care facility has to be confined to their room. And, that regardless of whether anyone in the building is COVID-19 positive, regardless of whether they're symptomatic or have been tested positive. And one of my concerns is that if we go too far in order to stop the spread of COVID-19, we're going to, literally kill people because of the social isolation. And so I think it's a difficult balancing act that we've got to take with respect to that.
Well, Michael writes in, he says, what can we do for our loved ones to help relieve their social isolation, particularly for those who have mobility and hearing impairments, which make communications at a distance a challenge? And he goes on to talk about locking everybody up until there's a vaccine is going to have enormous consequences on mental health. So he certainly agrees with you. And Craig Cornett from the Association of Health Facilities, I'm sure you agree with that as well, that this social isolation which you have put into place, I guess under state regulation, is having enormous impacts on the residents given
Correct.
These circumstances.
And families. I would just mention to you, I think at least in the skilled nursing sector, we are looking right now. We're partnering with other organizations and with the Department of Aging to look to see what kind of technologies we can improve. In some cases, some facilities have been able to do FaceTime with their family members. I would just point out to you, though, just one of the challenges here, though, if you have a laptop to do FaceTime, you have to disinfect the laptop before you can bring it from room to room. So just to show you, just to demonstrate the difficulties that this virus, in terms of the spread of the virus, entails. So, but this is. I would also mention to you that I suspect some of these limitations on visiting are probably going to have to continue for a while, realistically, because even after the spread is reduced in the community, residents in these facilities will remain very vulnerable for a longer period of time. So for much longer until there is a vaccine.
Let's bring Nicole Howell back into the conversation. Ombudsman here in Contra Costa and Alameda. We've heard concerns about lack of testing. We've heard concerns about PPE. So where does the buck stop on this? What are you doing in advocating for the residents to get PPE and get testing? What roadblocks are you running up against?
Yeah, I think it's partly what Craig said in that long-term care sometimes is a misunderstood field. It's sort of at the nexus of caregiving, also at healthcare, but no one entirely claims it. And so it's taken several weeks for public health and others to understand this dynamic as they're charged with taking the lead here to get the facilities appropriate PPE, appropriate testing, to understand the dynamic and cultural issues within the industry. So one of the things that we are doing is we're partnering with other entities to do emergency PPE distributions to what you would know as assisted living or the 6 beds we talked about through the Emergency Operations Center to shortcut the supply chain to get them the supplies and give them to them so that they can care for their residents appropriately as they are being asked to do from licensing and from CMS and others. But I think that it's taken several weeks to get everyone up to speed as to what needs to be done and how you can engage with these facilities. So what I would hope in the future, and while I hope this never happens again, is that we have lessons learned where this information is put into the emergency plan, something all facilities are required to have to understand how to work more cooperatively with local public health, to understand how to address infection. I think the issue is, again, facilities are skilled at dealing with infection or should be, but sometimes the enforcement around that has been rather lax. And I agree with Craig, the frontline caregivers are truly the heroes in this. But unlike the other heroes that are being recognized on the nightly news, they are not receiving either crisis or hazard pay for this work, whereas the local Safeway and others, also represented by union, which many long-term care workers are, they are not seeing the increase in their compensation that they should to be working in these long-term care facilities. And again, I say we are not providing enough incentive to facilities to have staff working at only one facility at a time, whether that be through overtime, additional hours, additional hourly pay. And I think what we're seeing is facilities, staff work at multiple facilities and could be taking that virus to other places. So I think a lot is being done.
I want to follow up on that. No, it's okay. I want to follow up with that in a moment about the staff because I know that they are doing incredible things under difficult circumstances, and there's been some folks who have written in about that. But let me pause for that moment and bring in Mike Dark. Mike, thanks for your patience. You're a staff attorney at California Advocates for Nursing Home Reform. You've been in this space for a long time before COVID-19. Why don't you take a moment, describe what you see happening? Should we have seen this coming or no? But how are we doing? What's your assessment?
So here at Tanner, we usually help consumers in long-term care with issues like nursing home and assisted living evictions, elder abuse, education regarding Medicare and Medi-Cal reimbursement, things like that. But for more than 6 weeks now, really nearly since the start of the pandemic in the U.S., we've been focused almost exclusively on COVID-related issues, including things that we have talked about, like restrictions on visitation, the collection of data about where the virus is spreading, but also how regulators and legislators might help residents in facilities where COVID is spreading. And I think we have already seen thousands of people in nursing homes across the United States and assisted living facilities die from this pandemic. And I agree with Anita, actually, that I think those numbers are almost certainly an understatement, and we can talk about why later. Those numbers are a tragedy, but what would make those deaths much more sad is if we don't learn anything from them right now, while we can still save lives. And here's what I think we already do know. Social distancing is working to save Californians, but not people in long-term care. It's just not possible to maintain safe social distance between a healthcare worker who is feeding by hand a resident of a facility, or between 3 residents with Alzheimer's who are sharing a room, or between the residents in a 6-bed, what we've been talking about, assisted living facility, which may also be someone's home. And what we have relied on to prevent the spread of the virus in those environments is good staffing and good infection control. And the fact of the matter is, long before the virus hit us, we had neither. Nursing homes in California suffered from terrible infection control. In fact, it is probably the most common citation in inspections. And the problem was that regulators just didn't take it very seriously. There were few penalties, low, very low, if any, financial penalties, and almost no follow-up. And understand that when we're talking about infection control, we're not just talking about personal protective equipment. It's things like poor hand-washing practices, low-tech issues that are actually relatively cheap to solve. And Craig is right that there are plenty of regulations. This is a highly regulated industry, at least nursing homes is. The problem, however, is that those regulations have been very poorly enforced. And it is hard to turn bad practices around in just 6 weeks, even when they're under a spotlight. And on the point of staffing has always been just as much of a problem in California, even before the virus hit. You had nursing homes that were extremely thinly staffed. Most people, I think, don't realize that most care in nursing homes is not provided by nurses, but by aides, most of whom are making minimum wage, and who, because of that, have to work at multiple facilities, as Nicole says, in order to sustain their families. They don't have a choice. And it's really those problems in combination, I think, that were the accelerant for the virus in nursing homes in this state. Healthcare workers picked up the virus in one facility, carried it inadvertently into another, not because they wanted to. They didn't even know. They could have been asymptomatic. They probably were. So even screening them for fever is not an effective way to prevent that spread. And once the virus is in another facility, low staffing and existing infection control problems let the virus spread like wildfire. And I think to make matters worse, some of these things we've been talking about, the restrictions on family visitors, the restrictions on ombudsman, the restrictions on even inspectors going into these facilities, were well intended in that they were supposed to prevent the spread of the infection into the facilities on the backs of these people. But the virus got in anyway. And in fact, those numbers that we're seeing from the state are almost certainly, as I said, hugely underreported. The virus is widespread in California facilities. And at the same time, what we have as a result of these restrictions is no eyes on the ground, no safety net to make sure that resources and attention are going to facilities where residents and workers are sick. It's true that many facilities still don't have adequate access to testing, but also, based on calls that we get, some facilities don't want to test because they don't want to report that they have the virus. They're for-profit enterprises. They're businesses. And it's bad for business if you report that the virus is in your facility, even if in the short term it might get you more resources.
Okay, let me stop you there. Stop you there, Mike. That's a pretty tough hit. I'm sure Craig Cornett from the Association of Health Facilities has a different view. And let's give him a chance to respond, and then we'll continue the conversation.
And there's some things that Mike and his organization have said that I don't disagree with. I think they've actually also said it's important to put a priority on testing. It's important to put a priority on PPE for these facilities, and we certainly agree with that. I would just say that there are very strict regulations right now, though, on these reporting requirements. I would also say that on the infection control, that has not been our experience at all in terms of lackadaisical enforcement of these. And by the way, the Department of Public Health is actually coming to buildings. They are doing that now and following up on buildings that have had infection control issues in the past. So they are doing that. And and they are allowed to, under the governor's order, the regulators who do that are in the buildings currently. You know, I've got if it would be all right with you, Senator Glazer, I have Deanne Walters on with us here today. She is our Director of Clinical and Quality Affairs, and she is a longtime administrator, an award-winning administrator in facilities in California. So I thought I'd just maybe let her comment on that. Some of those
Deanne, welcome to the call. Please share your thoughts.
Thank you very much, Senator Glazer. Appreciate that. It's hard being a long-term administrator in healthcare and so passionate about the care that facilities provide for all these years. I know that there are a lot of concerns out there, but the people working in the facilities, the CNAs, they are working unbelievable hours in order to provide the care that the residents in the facilities need. And in regards to the infection control, we work extremely hard to meet all of the requirements around that. And of course, we are people, so there are times when, say, a CNA might not wash their hands after removing their gloves before walking out into the hallway, but those things are things then that the surveyors indicate on those reports, and that's what you see as a deficiency. And the facilities work toward improving that through training and additional education in order to make those corrections. And they have to make those corrections, otherwise they do not stay licensed. So it's really important to know that the facilities are out there and they're working very hard, and they're not just blowing off regulations. They are working really hard to meet them and provide excellent care to the residents as they are there every day. They're family to these residents as well. So they're working very hard to do that.
Thank you. That's Deanne Walters. She's the Director of Clinical Affairs for the California Association of Health Facilities. Let's bring in back Anita Shabria. You've heard the back and forth, I'm sure, in your reporting. You hear this quite often, but the point that Mr. Dark, Michael Dark, from the California Advocates for Nursing Home Reform is making is that there have been underlying problems, deficiencies for some time in these facilities. Does your reporting back that up?
Absolutely. I mean, we've gone back through the inspection records of several facilities that have the largest outbreaks right now, specifically looking for those low-level infractions like hand washing. And almost in many instances, they are there. There is at least a 1 to 3 year history. That's what I've looked at so far, where you do see those kinds of infection control problems. And one thing I would just caution all of the listeners to think about for a moment is that there's a very large difference between what we hold facilities accountable for and how we support staff and patients as this crisis happens. So I don't think anyone would dispute that the mostly women of color, mostly minimum wage women working in these facilities are just a resource for all of us and are working in life-threatening conditions for little pay and are really, truly heroes of this moment. But that's an entirely separate issue from how we feel about the administrators and owners of the facilities and their history of standards.
Very good. That's Anita Shabria from the Los Angeles Times. Done a lot of reporting on this issue. Thank you for your perspective. Renee writes in, and this may be a question for Mr. Cornett from the Association of Health Facilities. She writes in and she says, many health workers in long-term care facilities and in-home care situations do not have the option to stay home, even if they are at high risk because of underlying conditions or because they are not feeling well. She writes, they are a forgotten class of health workers when it comes to worker protection, including PPE and adequate testing, that putting them and their families at risk. What can we do to support these health workers? Craig Cornett, any thoughts there about, do you feel like that they're getting enough support from your owners out there, and if not, what can we do to help them more?
Well, I think the for those who work in skilled nursing certainly are, and in fact, most facilities, if someone tests positive, they are generally told to take off 2 weeks or go home for quarantine. That has actually created even more of a staffing problem, I will tell you, in getting staff, because, like I said, staff were already short. I believe that to be the case. Now, I got the impression from the question was also about supporting home care workers too? I can't remember how it was phrased.
No, just helping the healthcare workers that they're on the front lines. They sometimes don't feel like going. But haven't some of the reforms, federal and state, provided sick leave benefits that they get 2 weeks?
They do. They do. Yes, they do, and they can actually get. They almost virtually always do that, and they can get leave to take care of themselves or to take care of loved ones at the same time. I would also tell you too that almost every facility I'm aware of right now are paying extra to their workers right now, because they are paying hazard pay right now. One facility in Contra Costa, I was talking to the administrator yesterday, and they've added substantial increase in the wages, in the hourly wages for all of their employees, just because of this, because they know what they're going through right now to support them. But yes, and they should be.
Good to hear. And let me ask another question. Michael writes in. He says, my 91-year-old mother, who suffers from mobility issues and hearing impairment, is currently in a Contra Costa located assisted living facility. He goes on to say about having his loved ones locked up in these care facilities is creating great stress. And he asks, what can we do to help our loved ones who are in isolation? Are there some creative options or ideas to help best practices to allow family to interact? You've talked to your operators around the state, Mr. Cornett. Any thoughts about how we could help those who are feeling so isolated? How could they not, right? We're feeling isolated in our homes, let alone all by themselves in an assisted living facility.
Yeah, I might actually kick that to Joel, since it sounds like the question is really more assisted living, if that's okay.
Yeah.
Sure, Joel, please.
Sure. Thanks, Senator. This is, I mentioned earlier the tension. One of my clients came up with what I thought was really an excellent protocol. This is an assisted living community up in Davis, and what they were proposing to do was to allow families to come. They have a fairly large outdoor area. Allow families to come. Families would have to stay in their car, be 10 feet from the resident, who would be seated, and they would do it in groups so that no residents were congregating near each other, and propose that. And the Yolo County Health Department absolutely shot it down, would not permit even that sort of a visit. And we're working. I'm very involved with the California Assisted Living Association, and we just had a conversation about this earlier today with our board, and we're going to try to work with the Department of Social Services to see if it can coordinate better with public health to try to ease some of the restrictions so that we can get more creative. And people are doing creative things. There are communities where residents have balconies. They can go out on the balconies. There have been drive-by parades. I've got clients that are doing group activities where residents are sitting at their doorway, and whether it's singing or some kind of entertainment that staff is doing kind of wing by wing. So people are trying to get creative, but it's, in some cases we have at least one, if not both hands tied behind our backs.
Well, we certainly need to find ways to be creative, because you have to think in every one of these cases, this is my mom, this is my dad, this is me in difficult circumstances. How can we not find a way to make this easier and better? And one of the things that strikes me, and I know for anyone who has had a friend, a relative in any kind of hospital setting, that having that extra person in the room that can, if someone doesn't respond to a call button, that can go out and find a nurse or a healthcare provider to come in and help, that those assistants that we provide are so important and so valuable, and it would be what you would recommend to anyone who has someone in these circumstances. And yet, the same would apply to these assisted, nursing facilities or skilled nursing facilities. That extra person, that son or that daughter, that nephew, it's so important for their well-being, and not just to have someone to talk to. And we have got to find a way. And we're hoping that this is not the future, right? This is the moment right now, and we're trying to get through it. And at some level, no one could ever predicted we would be in such dire straits that we're in now, but it is the moment. But I know it breaks all of our hearts to hear about elderly folks in these circumstances that have no one there, not just to talk to, but to help and to be that extra pair of hands to make their life a little bit better. Let me bring back in Michael Dark from California Advocates for Nursing Home Reform. Mr. Cornett has talked about efforts to try to raise the pay to support them with sick leave during these difficult times. Do you feel like that support is out there? What would you say to that?
So this pay raise idea is crucial in that, singing a song out the window at 7 o'clock or doing, video homages to healthcare workers is great, but what they really need is more money. They need more money so they don't, as Nicole says, have to work at multiple facilities. That's just good infection control. And if you're making $12 an hour, a 20% raise still only gets you to maybe $14 or $15 an hour. And so while we have seen raises for some of these workers, they have been on that order, which still is not enough to let these workers work at just one facility. It's going to have to be something like double their ordinary pay to make up for a lost job. But one other quick point, Senator, on some of the restrictions on visitation that we are talking about. That question is so thorny because it is a balancing test between the harm that restricting visitation causes and the benefit of preventing the virus from getting into facilities. My own thinking on this has evolved over the last few weeks as the virus has made more and more inroads into facilities across California. I think now that it is so common now, the virus, in California long-term care facilities, that the calculus has changed, and that these people who come in and visit don't just provide moral support, but a lot of them were actually providing care. They were doing things like brushing the teeth of their parents and grandparents, making sure that their linens were clean, making sure that they were well fed. And their absence is taking a terrible toll, especially now given the difficulties in staffing. I think as this epidemic goes on, we're going to need to move towards a model where at least some carefully regulated visitation is going to have to be permitted for these people to survive.
Very good. That's Michael Dark, who's a staff lawyer for Advocates for Nursing Home Reform. Let me bring back in Joel Goldman, who advises senior assisted living facilities in our area, to answer a question from Martha. She writes, if my mother-in-law tests positive, can she be evicted from her assisted living home? If we take her out, will she be prohibited from going back? What are our rights here? So I know you are the defender of the facilities, but can you speak to what's the general practice if someone has been found to have the COVID-19 virus?
Sure. It's going to vary from county to county depending on the directives of the County Health Department, Department of Social Services has instructed us to abide by what County Health is saying. In many counties, if someone is positive, COVID-19 positive, but if they are asymptomatic, and by the way, even among the frail elderly, we're finding that about half of the people who have tested positive have no symptoms at all. And then there's another significant percentage who have only mild symptoms. In many counties, they will not, they do not want us sending those residents to the hospital. There are other counties that are saying if anyone tests positive, they need to be sent out. I believe Ventura County is taking that approach, which is contrary, I'd say, to a majority of counties. In most counties, if the resident is not showing symptoms of distress, they will remain in the community, obviously isolated in their room. If a resident is sent to the hospital when they are ready to return to assisted living, it would be illegal for a licensee to refuse to take that person back.
Great. Well, I want to ask Anita Shabria from the LA Times about this, but before I go to her, I'm going to close our conversation with a very hot topic in and of itself, and that's the issue of immunity from lawsuits, which a lot of the facilities are asking for. But hold that for just one moment. Let's go to Anita Shabria from the Los Angeles Times. What in your reporting, where you have COVID-19 cases, can they be kicked out? Have they been kicked out? Can they come back beyond self-isolating or the isolation within a facility? Anything you've seen in your reporting about how the different facilities are handling COVID-19 patients?
We're seeing it's really different from facility to facility as they struggle through how they want to handle it and also what their business model is going to be moving forward. We're seeing some facilities that it looks like they might end up catering to COVID-19 patients. There is a financial incentive there. There's a higher payment for those kind of sicker patients. And so I do think that you will find some facilities that are, for various reasons, drawn to at least having surge wards. But we are hearing rumors of some patients being transferred out when they did not want to be transferred out, or or not being let back in after a hospital stay. We're really hearing things all over the place.
Okay, then let me bring in this interesting question. Let me go to Craig Cornett from the Association of Health Facilities. I understand you've written a letter, or at least your association or a part of a group of associations, to the governor asking that nursing home operators be granted immunity from lawsuits. Can you give us a snapshot at what you're asking for and why?
Yeah. Basically, we, along with the California Hospital Association, the Assisted Living Association, and a number of others, have asked for limited liability immunity here. Given the situation that people are dealing with, that facilities are dealing with, the caregivers are doing the best they can to ensure that all residents are provided the necessary care and treatment, but they can't ensure that, especially given the issues they've had with resources, particularly PPE, particularly not having limited access to equipment and supplies and testing. So the request for liability protection that I think we have made, and by the way, this has been granted in quite a number of other states, it does not foreclose claims at all for abuse or neglect or any kind of willful misconduct or any kind of criminal misconduct. That is not, I've seen that reported, but that is not what the request is at all. It's really to avoid what I think could easily become a lot of second guessing that will inevitably occur because of the unintentional outcomes, the unintentional actions that caregivers trying to do the best they can under these incredibly difficult circumstances. That is the issue.
Very good. That's Craig Cornett, the CEO and President of the California Association of Health Facilities. Let's give Michael Dark perhaps a similar or different perspective from California Advocates for Nursing Home Reforms. What do you think of the request for immunity from lawsuits?
We think it would effectively remove one of the last safety nets that residents in these facilities have, and this is why. The concept behind the request for immunity is something like if you're in World War II and you're an ambulance driver and you come upon a wounded soldier in the road and you try to resuscitate him, you shouldn't be sued for negligence if you didn't do it correctly. And I think everybody would sympathize with that. But that's not actually the situation in California nursing homes. It's not even the situation in California hospitals, in acute hospitals. It might have gotten that bad in places like Elmhurst in Queens and New York, but we're certainly not in that battlefield scenario in California. And what's especially troubling to us about the proposal, or at least what we have heard about what the governor is considering, is its breadth. And it is not, what we understand is that it would not have a carve-out for reckless conduct, which is to say it would still immunize conduct in which an operator or facility knows that it's doing something dangerous and does it anyway. And that reckless state of mind actually underlies several statutory protections that elders get, including things like the Elder Abuse and Dependent Adult Civil Protection Act. So we're very troubled by the proposal. We are hopeful that Governor Newsom either does not sign it or at least provides the kind of carve-out that we see in other states which have adopted similar proposals.
Great, thank you for that, Mr. Dark. Nicole Howell, what do you have a view about immunity, good, bad, and not the most important thing you're facing in your job right now? What do you say on this issue?
Gosh, I actually have Cass' letter here in front of me, and I was so glad to hear Craig quote from it, because in the text it actually calls for immunity from administrative sanctions, criminal or civil liability, or claims from any injury, death, or loss alleged to have resulted from any act, omission, or decision. And so I think it's far more reaching than what they're letting on today. I certainly wish we didn't live in as litigious culture as we do, and we are not a program that encourages sort of, just being angry and suing a facility. What I think needs to happen right now is facilities need resources. They need a flood of resources. But if a facility does act poorly and they are not asking for help and they are not giving appropriate care, I do not believe that they should be immune from appropriate licensing and other enforcement measures. I think, again, as Michael says, it's one of the last lines of enforcement. Regulations have been thrown out and discarded over the last several weeks at a rapid pace. It is difficult for professionals to keep up. If we are having challenges managing it, how can a family who has someone in a facility who is distraught over not being able to see them, who is concerned for their care, be able to manage this? And I believe that disregarding facilities' responsibility to take care of this sacred responsibility is wholly unconscionable.
Okay, well, that's you're not soft-pedaling your view there. Thank you for sharing that. Let's bring Anita Shabria back in from the Los Angeles Times for a final word. Anita, where does the story go? What does, can you look into your crystal ball and give us a perspective about some of the other issues that are going to be discussed, debated, reported on going forward?
Well, I certainly agree with many people who have spoken today that we are just seeing what's happening inside these facilities. I sadly expect the numbers to be far greater in coming weeks as more testing is available. We've seen in Los Angeles a push to test everyone in these facilities, workers and residents. I think that you will see that take place in other parts of the state. These facilities need to be a priority for testing, so that we do have a better understanding of what's happening. And, for everyone who has a family member there, I would encourage you to reach out to someone like Nicole. I would encourage you to ask the questions. Every single person who has a family member or a loved one in these facilities has a right to clear answers and clear information, and should never hesitate to ask for that.
That's Anita Shabria from the Los Angeles Times. Anita, thank you for your great reporting that you're doing on this subject, and many others. Inform and enlighten all of us readers, and we're very appreciative of your good work. Nicole Howell, thank you for being an advocate here in Contra Costa and Alameda counties. You've heard the discussion and you've felt it directly about testing, about disclosure, about personal protective equipment and the lack thereof. We appreciate you fighting. You got to call me more often, because I want to be your partner. And helping do all those things here in our community. They're all so critically important. There's been a lot of talk about each of those things And I know progress is being made because I see reports every day about expanded testing and PPE requests that they tell me are being fulfilled. But I hope that you can stay in touch with me in my office going forward, and we appreciate all that you are doing. Craig Cornett, I guess a heck of an initiation to your job with the California Association of Health Facilities, but there's nobody probably more able, more knowledgeable, and more experienced in our world of politics and health and finance than you, and I know you're in a great place to do your best work for that association, and I really appreciate you being a part of the conversation today, along with Deanne Walters from your team. Joel Goldman, you're an articulate advocate for the assisted living. I can tell that you are living this issue every moment of your day, and as an area resident in my neck of the woods, I know you feel and your neighbors are sharing the difficulties and pain of all that we're going through. But thank you for your great advocacy. And Michael Dark from California Advocates for Nursing Home Reform, I'm sure you didn't expect to be in this terrible morass that we're feeling has enveloped all of us. But you're a great articulate advocate for our folks that are in these facilities. I read your quotes in many publications as you fight for their rights and their care, and we thank you for your important advocacy and being a part of this conversation as well. Well, that concludes our 15th Coronavirus Town Hall. Thank you all for hanging in there and listening to this important conversation. It is being recorded, and it will be on my website for those who want to go back and hear something again or share the information with a friend who might be interested in this issue. That website is sd07.senate.ca.gov. At that website, we have a tremendous amount of resources and information from the Center for Disease Control, the state, the county, public health departments, and the Office of Education, and many more places. It does have our 14 other town halls where we talked about coping skills and caring for animals and help for small business and the unemployed and the grocery store chain and all kinds of other subjects in which we could bring experts in these fields to come and share their information directly with you. I know how hard this has been. In fact, I thought the news yesterday might have been the toughest day for me because we've endured so much, and yet you hear the word that we have to shelter in place for an even greater period of time. That was a body blow for me and my family, given how much progress we think we have been making. And I think it speaks to the fact that we have made progress. We can see it in the numbers, but it's not enough. And if we're going to stop a second wave and a third wave, which may be inevitable, but at least reduce the impact of those second and third waves, we have to stay the course. We have to still do something that is very uncomfortable and unsettling, and that's the shelter in place. I'm hopeful that the details of the shelter in place order extension tomorrow will lighten that load on us. I'll be listening and watching for those details, and we were going to talk about them on Thursday at our town hall with some people on the front lines of that decision, those choices, and you can ask further follow-up questions in the hopes that it will help all of us understand and cope and do what's necessary to control this virus. As you know, I'm holding these town halls to bring accurate, reliable, up-to-minute information. I hope it was helpful to you today, and I hope that you will endure, stay strong, adhere to our physical distancing and shelter-in-place requirements. It will be better for it, as hard as it is for enduring it today. But what we do today does affect what happens to tomorrow. So hopeful that you and your neighbors can stay strong, and we will get through this, and we'll see a brighter day sooner than we might think. So with that, thank you again to all my guests, to my wonderful staff, Dan Weintraub, Steve Harmon, George Escudia, and team who helped prepare me for these conversations. And with that, I want to wish everyone a very good day. Thank you all so much.